And opinions expressed on the following show are solely those of the host and their guests, and not those of W4CS Radio, its employees, or affiliates. W4CS makes no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. Any questions or comments should be directed to those show hosts. Thank you for listening to the Cancer Support Network on W4CS.com.
Hello, everyone, and welcome back to Survive and Live Well, tips to treat and beat cancer. I'm very excited about today's show. I've been looking forward to doing this one, and I hope you are as well. If you have any questions during the show, please enter them in the chat room, which again is located in the lower right hand of your screen. You can be incognito, or you can actually sign in with your own name. We'll try to get to your questions. If we don't, we'll get to them later. So today we are going to talk about cancer stem cells, the type of cancer cells that are resistant to treatment and which are the only cells that can metastasize. Perhaps your oncologist has mentioned this, or more likely, he or she has not. Well, considering that metastasis is the primary cause of death for most cancer patients, it would seem to me that controlling these cells would be of primary importance to your oncologist. As Dr. Brad Weeks has so aptly stated, treatment which fails to address the toxicity of cancer stem cells is futile and irresponsible. Well, today we intend to fill in that gap between what your oncologist tells you and what you need to survive and live well. To discuss this super important topic, I have with me again today the wonderful Dr. Michael Schachter, Director of the Schachter Center for Complementary Medicine. Michael, it is so wonderful to have you back on the show today. It's been a while.
Elyn, it's a pleasure to be back with you as well.
Well, I'm looking forward to this. As you know, this is a topic that is just so very important to me. So I'm excited to tackle it with you.
Mm-hmm.
So, Michael, maybe we should start out by first explaining what cancer stem cells are. What are they? Why are they important? And why don't we know enough about them?
Well, I think the first thing to talk about actually is what are stem cells. And because then that will lead us into what are cancer stem cells. And stem cells are cells that appear in all of the tissues throughout the body in small quantities, and they are the cells which help to repair damage whenever it is done. So what happens is that cells may get damaged, and then they send out messages, chemical messages, and it results in a stimulation of these stem cells, which then can differentiate or become the same cells as the tissues that have been damaged. So that's what stem cells are, and they're present throughout the body. Interestingly enough, there was a theory about cancer called the trophoblastic theory of cancer that was presented by John Beard, a Scottish embryologist, in 1911. And he really first began to talk about the nature of cancer and how it may relate to the development of the fetus in the person. And what he said was that during the course of development of what goes from the fertilized cell, it starts to develop some other cells, and the first one to develop is something called the trophoblastic cells. Now, the trophoblastic cells actually are cells which invade the uterus, the endometrium, or the inner lining of the uterus, and these trophoblastic cells become the placenta. And this is what allows the fetus to grow and the baby to develop. So these trophoblastic cells are, and what he proposed was that under certain circumstances, these trophoblastic cells, which have actually the exact characteristics of cancer cells. In other words, they're anaerobic. They do not require oxygen for energy. They are invasive. They can invade the inner lining of the uterus, the endometrium, and they can actually, destroy tissue and so on. Very much the same characteristic as cancer cells. And it turns out that around the 56th day of gestation, as the fetus is developing, suddenly the trophoblasts stop invading tissue and stop doing all these things. And it turns out that that is the time when the embryo develops a pancreas. And the pancreas then begins to secrete enzymes that stop the trophoblasts from growing. So he hypothesized really that what cancer cells were trophoblasts in the wrong place and at the wrong time. So and so that's what that was his idea of what cancer cells are. So now what happens? What he further proposed was that as the embryo develops, there are germ cells, what he called germ cells, and in babies that are male babies, these 80% of these germ cells go to the testes, and in girl babies, they go to the ovaries, and these germ cells become the sperm in the man and ova in the women. 20% of these germ cells, instead of going to these sexual organs, go throughout the body. And they are distributed through all of the different cells of the body. And they are what become the stem cells. So these stem cells are cells that are used for regeneration. They're what are called pluripotent cells, which means that they're capable of differentiating into all different kinds of tissues depending upon what kinds of chemical messages they're getting from the environment. So that if there's damage to a particular area, the messages go out and these stem cells turn into a repair of whatever is damaged. So that's what stem cells are. So this is very important. The stem cells that become discombobulated, that are where something becomes wrong with them, they are disrupted. They can become cancer stem cells. So so when the cancer stem cells develop, these are very important, and they have really begun to change conventional oncology over only the last 10 to 15 years or so. There has been an awareness of this because the cancer stem cells, as you said in opening the program, they are the only cancer cells that are capable of metastasizing, of spreading past organs and going to other tissues. And really, almost all of the deaths caused by cancer are not caused by the growth of the tumor. It's caused by the metastases, cancer metastasizing to the lungs or the liver or the brain, and then growing and becoming, and that's really what eventually results in the death of the person.
That's
so
right,
these
shutting
cancer
down.
stem cells are very important. What? I'm sorry?
Yes, that's right. I mean, that's really what happens. It ends up shutting the organs down, and then there's the end of life. It's not those early cancers that everybody's saying, oh, well, I have a tumor. Yes, but that doesn't kill you. It's the metastases that gets to us.
Yes. And really what's also something that is certainly not well known is that the cancer stem cells constitute only a small portion of the solid tumor. So it only may constitute about 1 to 5% of the cancer may consist of these cancer stem cells. And this is extremely important because they constitute only a small volume of the actual cancer. So the tumor, what is commonly being used by conventional oncologists as determining whether a treatment is working or not is shrinkage of the tumors. They talk about regressions, partial regressions, partial responses, full response. A full response is when a tumor basically disappears. It's no longer present. That's a full response. I think when you get a 50% reduction in the size of the tumor, that's called a partial response. And often the approval of the drugs through the FDA are based on these responses. But it turns out that when you actually do studies and try to relate the size of the tumor to the longevity of the person, how long the person survives, or animal survives for that matter, from the cancer, there is very little relationship between shrinking of tumors and their survival time. And that can be understood if we understand that the important thing here are the stem cells, which metastasize, and not so much the other cancer cells, which do not metastasize but can shrink in the presence of especially conventional treatments.
Right. This is a really big point that I just want to reiterate a little bit. It strikes me as so unreasonable that oncologists, they get so darn excited when their treatment successfully shrinks that tumor, right? They're doing this dance. They're saying, hey, we got it 80% down. And while sometimes you need to do that because it's pushing on a vital organ or something like that, but for the most part, it doesn't matter. It's not cause for that happy dance because the size is misleading. If as you said earlier, that it's only 1 to 5% of a tumor that are the cancer stem cells. Well, if you remove 80% of the treatable cancer cells, which we're probably talking about in a little bit, but the ones that actually respond to chemo or radiation, and you leave the ones that don't respond, and they're the most dangerous ones, you've really accomplished nothing by minimizing the tumor.
And in fact, your volume of cancer now, you have a much higher percentage of cancer stem cells relative to non-cancer stem cells than when you started.
That's right, and they're empowered by the treatments that they just gave you. So now they're on a mission.
Well, that's exactly right. And furthermore, there is some research that show that when you kill cancer cells, they, like any dying cells, give off these what are called cytokines or chemical messengers, which then bring about a stimulation to the stem cells in the area. And if the stem cells happen to be cancer cells, they may actually directly stimulate the growth. So whereas chemotherapy and radiation frequently will shrink a tumor and will frequently bring about the reduction in size, they may actually stimulate the cancer and metastases, so that actually the survival time may not be so good. And of course, this is one of the peeves that I have with convention. I have many of my patients who come and they're going to major medical centers and they're getting these often CAT scans and often PET scans, every 3 months to determine whether or not the treatment is working. And, of course, every time they get a CAT scan, it's equivalent radiation of about 100 chest X-rays, and PET scans about 500 chest X-rays. So they're getting all of this radiation, which itself is oncogenic or causes cancer, and they're getting that, and then they're being told, well, the tumor is shrinking, so it's working. We'll continue with whatever we're doing, or it's not shrinking anymore, so we'll stop what we're doing, and we'll give you some other other treatment, which might be radiation and or other forms of chemotherapy, and this is really what goes on, and so. I'm very concerned because I don't think there often is a very much of a relationship between shrinking these tumors and necessarily improving the survival time of the patient. And furthermore, of course, the quality of life is frequently not improved. In fact, it's made worse by all of the side effects from the various conventional treatments that are going on.
Absolutely. So and if there was any doubt that we were wrong, people wouldn't have all the recurrences. People wouldn't constantly be back for more treatment, right? If these darn treatments worked, they would work. But they don't work because you're so-called cancer-free. Boy, the doctor says, go on your merry way. You're cancer-free, but then it comes back because he hasn't done anything or she hasn't done anything to combat this problem, only did that chemotherapy or the therapy or the radiotherapy and didn't even target the most important part.
Exactly. So the question then is, well, if radiation and chemotherapy don't attack the cancer cancer stem cells, I guess the next question is, well, what does? How can we help? What tends to increase the rate of growth of these cancer stem cells, and what, if anything, can we do about it? And I think that one of the things that we can say is that the inflammatory processes, inflammation that we hear so much about in terms of pushing cancer. And inflammation can be caused by many different things. It can be caused by eating, for example, a diet that has lots of sugar and refined foods and processed foods in it. That tends to be very inflammatory, and it causes inflammation. And the inflammation then results in stimulation of these cancer stem cells. So there's a whole series of these things. I mean, also, we know now, fairly recent information is that inflammation seems to be occur as a result of various psychological states. For example, losses of a person, of a relationship, of a job, various losses. For years, we have been told that those losses, those psychological traumas, seem to result in either people developing cancer that hadn't been diagnosed before or in stimulating the cancer. So stress becomes a very, very important thing. And so we know that so the psychological thing is a very important part of that, and we want to try to keep the stress and psychological stress down as much as we can, and we talk about that a lot as one of the alternative approaches. It shouldn't be alternative, it should be mainstream approaches to helping cancer patients deal with their stress and help them to calm down and so on.
Right, and it can be a trauma from childhood or even before then, but I think that is a big point to mention here, that is not part of oncology. They don't even recognize, actually, they don't recognize any of the causes of cancer, but they have absolutely no interest in understanding that cancers don't just happen and that traumas, I would say, if you go back to Hammer's work and all the others, doctor from Germany, they have traced each cancer to a specific type of trauma in one's life, a psychological stress. And this is something that isn't even part of oncology after all of these years. And this is not new news. It's news to them.
Well, that's right. But the beauty here is that as we begin to understand this cancer stem cells, and as that begins to gradually emerge into conventional oncology, then it gives you a much more firm basis to show scientifically that there is a relationship and that these things should be dealt with. And I mean, we've been saying that for a long time, but I think this gives us some scientific basis for understanding some of that. So the next thing that comes up is now. So what's been happening? How is this whole area being affected what role is it playing in conventional oncology? And right now, it's just beginning to be looked upon, and there are still many oncologists who are very much involved in the conventional approach of the surgery, radiation, and chemotherapy, et cetera, that don't pay much attention to this. But there have been a few groundbreaking people who have, and they are not, quote, alternative cancer specialists. They are very much embedded and involved in conventional oncology. Perhaps one of the best examples would be a gentleman, a doctor named Max Wicha. I hope I'm pronouncing his name right. It's Maxwicha, and he is he's very, very conventional. I think you can get more conventional in terms of his background. He got his MD from Stanford. He did his residency at the University of Chicago. He is the founding director emeritus of the University of Michigan's Comprehensive Cancer Center. And anybody who's interested can go online and just do a search for Max Wicha, W-C-H-A, M.D., and you can see a number of his lectures on YouTube. You can get to that and hear him and see what happens.
Yeah, you can find them on my website, too, because I wrote an article on it and put a couple of his in there, because he's an amazing person, and he has done so much research and lays it all out for anyone to listen to. It's
I think
amazing.
That's great. I'm glad that it's on your website. I should have checked that out and see, but that's wonderful, and people can just get it right there. And one of the amazing things that I learned from one of his lectures that I was not aware of, this is probably the listening audience would be very interested in that. He claims that he works primarily with breast cancer, and maybe a little bit with colon cancer. But he says a lot of the principles apply to virtually all cancers, or all solid cancers at least. But he says that with prostate cancer and breast cancer, the most common female cancer and male cancer, respectively, that by the time that the diagnosis is made, and even though the person is considered, as little as a stage 1, with no further cancer, that as much as 30% of those patients with that early cancer already have bone marrow metastases at the time of diagnosis.
Isn't that amazing?
To me, that's astounding, So, in other words, this whole business, we have to cut it out to make sure before it spreads and so on. It may have already spread. And to me, then the approach has got to be to build a person up and do things, non-toxic ways of attacking the cancer cells, and at the same time building the person up and getting them stronger and having them be strong enough to be able to deal the stresses of the cancer and the stresses of any changes that they'll have to go through. So anyway,
and, again, this is a big point, because instead of building you up, if you're giving somebody chemotherapy, it's actually damaging their immune system so badly that those stem cells, those mets to the bone marrow, they have a field day. They're being fueled. They're being fed instead of doing the opposite of supporting that immune system so that it can tackle those things.
Exactly. So anyway, what happened? This is a very interesting story that I got. I guess. It was a story that appeared. See, Dr. Witcher was interested in getting this notion of you, and because he was presenting his material to conventional oncologists and so on. But he has appeared in the public a couple of times, and there was one place where I picked up an article, a newspaper article that was written in February of 2010 by a writer named Mark Roth in the Pittsburgh Post-Gazette. And he quotes Dr. Witcher as saying that he hopes cancer treatments can avoid general chemotherapy altogether and just use targeted therapies against the stem cells. And then he points out in this article, he says, Max Witcher is coming to Pittsburgh today to deliver a startling message. And, quote, standard cancer treatments not only often fail to eradicate cancer, but can make it worse. And then he also makes the point, he says, that argument isn't coming from a fringe proponent of alternative medicine, but from the founder of the University of Michigan's Comprehensive Cancer Center and a pioneer in research on why cancers recur and spread to other parts of the body. So that appeared. Now, what happened was that after that article, Dr. Witcher really got attacked by
I'm sure he did. That was what I was just about to say, yes. Mm-hmm.
So he got complaints from all over, and he had to pull back and retract his statement. And he said, no. He says, I'm not saying people should not go ahead and get this standard of care. In fact, he said that the cancer patient should go ahead and follow the standard of care, which of course includes radiation, chemotherapy, surgery, and so on. And then after they do that, they should see, more or less when the treatment stops working, if they are eligible for a clinical trial that addresses the cancer stem cell issue, and as an adjunct to radiation and chemotherapy. So he pulled back, so this way he kept his good reputation among conventional oncologists by not trying to tell patients that they should avoid the standard of care.
Right. So he probably also avoided going to jail and being audited and every other thing that the people can. Those folks out there who don't like to hear such controversy are apt to create. But that's another story.
Well, absolutely. And he said he wanted to, and now his current work is he's involved with more research on these cancer stem cells than probably anybody else in the country, maybe in the world. And what he's trying to do now, though, is, you remember we said that these various chemical messengers or cytokines may stimulate the cancer stem cells to grow. So in order for that to happen, these cancer stem cells need to have certain receptors on them that are able to take on these inflammatory markers, and then which result in having them proliferate. And so what his research to a great extent is involved now is patentable subjects, patentable agents that are able to block the receptors of the inflammatory agents on the cancer stem cells. Mm-hmm. So this now allows them to develop all of these extraordinarily expensive cancer drugs that involve blocking the receptors on these cancer stem cells. And so you can expect over the next few years there are going to be many agents that come out, and some of them should be sold, for example, with these incredible prices. You know, drugs like Avastin, I believe I think it's somewhere between $10,000 and $30,000 a month, I think, for the treatment. Drugs like that, you're going to expect a whole bunch more of these drugs.
Mm-hmm. With a lot of side effects.
That will have some side effects. They may not have as much as the chemotherapeutic agents, right. But the point is that, and we don't know how well they'll work, but this is a way of really keeping the whole system working. And so he's very much involved in that. There's another doctor from Stanford, what's his name, Dr. Maximilian Dean.
Right.
And he's involved in this kind of research also. So they have focused on that, whereas most oncologists, I think, either don't know too much about or haven't heard much about cancer stem cells and don't really pay much attention to that, because if they're following the standard of care, there isn't all that much attention. But the cutting edge of conventional cancer research really has to do with some of these agents that will have to do with the cancer stem cells.
Right. I imagine that the oncologists, the few that are out there that are aware and concerned about cancer stem cells, may be addressing it without using such wordage, because if they said to you, oh, this treatment I'm going to give you is actually going to make things worse, but here's what I'm going to do to help offset that damage, they would look kind of silly. So they may be offering supplements and things like that without actually saying why they're doing it. And while that's commendable that they're doing something about it, I think that full disclosure would be very helpful.
Well, I think this is true, and I think that the point here that we should make is that there is research now which focuses on using anti-inflammatory drugs to treat cancer. So probably one of the best examples of that would be the drug called Celebrex, which is considered a non-steroidal anti-inflammatory drug that will reduce inflammation, and there are some studies showing that it seems to have beneficial effects as far as survival on cancer patients. And it may be through this mechanism that they're reducing the inflammation and therefore reducing the stimulation of the cancer stem cells. And I think this is all well and good, and it's nice that they're doing that research, but I think the part, of course, that's not really taken into consideration very much by conventional oncologists in oncology is that there are many, many, many natural substances that do the same thing, that are anti-inflammatory, but which don't necessarily have the side effects of, let's say, something like
Advil.
Well, Advil or Celebrex. And because what those drugs do is, although they have an anti-inflammatory effect, they tend to damage the inner lining of the gut. And when they do that, it results in the inner lining of the gut not functioning properly, and that can lead to such things as a leaky gut. Some of your audience, I'm sure, has heard of that, and where large molecules get into the bloodstream that shouldn't get into it and lead to stimulation of autoimmune problems, of allergy problems, and all kinds of things that can make you sick. So that's the downside of some of these chemical or these drugs that are used as anti-inflammatories in cancer. But the beautiful thing is that there are many substances that are non-drugs or supplements type of things which have some of the same characteristics but don't have these horrendous side effects that some of the drugs do. So, for example, curcumin, derived from turmeric, is an excellent anti-inflammatory agent, and there are lots and lots of in vitro studies and I think some animal studies showing that it has anti-cancer effect. But you see, since it's not a patentable item, that's not something that there's going to be a big fuss made over, because they can't make the tens of thousands of dollars a month or something like that on a drug like on a substance like curcumin.
That's right.
There's another one. There's a black cumin seed. There's another one which is very good. They've isolated a substance called thymoquinone from there that has very strong anti-inflammatory activities and some anti-cancer stem cell activity. So that's a very important one and a good one to know about.
And the important thing to note too is some of these natural substances have so many other anti-cancer properties and overall general health properties that you're getting bonuses, not detractions. In other words, you're not getting the anti-inflammatory, but you're creating leaky gut. You're actually getting the anti-inflammatory and some very, very potent health promoters and anti-cancer substances.
I think that's a very good point, and I think, I try to say to a lot of our patients that we're using these treatments with, and I say, the side effects of our treatment is to make you healthier, rather than to get you sicker, which is what most of these other medications do. So curcumin is important. This black cumin seed, which I've just gotten into heavily recently, seems to be very, very important. There's another substance called sulforaphane, which has a huge amount of research. This was originally done at Johns Hopkins. And that is substances called glucosinolates and isothionates, all from cruciferous vegetables and from broccoli and broccoli sprouts and things like that. So that work was originally done at Johns Hopkins, and now that's present in a number of different supplements. A number of the supplement companies are incorporating these extracts from broccoli, for example, into supplements, and it can be used. Another one is vitamin D. We've talked a little bit about that on previous interviews, and vitamin D I regard as one of the most important supplements that part of a cancer program, both in terms of prevention and in terms of treatment.
And you can get that supplement by sitting in a lounge chair.
Well, you can.
Not enough, but
not in the winter.
Not in most parts. Certainly not around here in the wintertime.
Right.
But, I always say you can get your sulforaphane in your broccoli sprouts. Just put them on everything. All during the day, each meal, throw a few sprouts on, because some of the better supplements for that are very expensive, and you can still buy them, but it's nice to be able to eat them. And in this case, it's nice to be able to at least supplement your supplements with a little natural sunshine, good for the mind and everything else.
Absolutely, I agree with that, and I think one of the things we would encourage anybody interested in either preventing cancer or people who are involved in any kind of treatment program is to eat whole foods and to stay away from processed foods, to try to eat organic foods, because these substances are much more concentrated in organic foods, and organic foods allows you to avoid some of the pesticides and some of the other damaging things that could be present in unprocessed foods. Of course, all of this stuff tends to be somewhat expensive, but of course and people spend a lot of money on things that are not so good, such as cigarettes and beer and alcohol and so on. And sometimes those who are more conscious of doing things healthily may be more interested in spending their money on foods that might be much better for them.
Right. So, fresh food isn't any more expensive than processed food. It just seems like it is, and you have to eat it reasonably soon. It doesn't sit in your closet for a few years until you get around to actually consuming it. So in general, it's not more expensive. It just seems like it's expensive when you go and you say, oh, that's $7 or $5 for this thing of broccoli sprouts. But if you ever picked up a package of frozen food or some kind of prepared food, it's that or more.
Well, I'm not the shopper in my family, so I don't pay that much attention. But I'm under the impression that if you go to a supermarket and pick up, equal amounts of broccoli there, as opposed to going to, let's say, a Whole Foods or an organic or a health food store and got the same amount of organic broccoli, the organic broccoli would be more expensive. Am I wrong?
Actually, You're wrong.
Oh,
Because
okay.
actually, we were actually surprised in our family. We have a supermarket, we have Fresh Direct, we have Fairway, and we have Whole Foods. And I don't want to. This is not a promotional thing for anybody, but I was never a Whole Foods fan. But we have found that most of our groceries are cheaper at Whole Foods than at any of those places.
Really? Well,
I
okay.
was
Then
absolutely
I
astounded. Cheaper than my nice little health food store that was always a bargain. So they are converting me. You just have to be very careful because not my Whole Foods is so small. They only have organic vegetables, but in many of them they have conventional and organic mixed, and either the customers put them in the wrong place or they're conveniently mismarked. So it'll say organic peppers and then you look at the pepper and it's not marked with the 9, it's not organic. So that you have to be very, very careful about. And you have to make sure too that you trust them, that they're not just taking a batch of peppers and sticking stickers on them, which is something I have seen done in many of these markets. But I will say that their prices are fantastic. And I'm going to throw one more thing out there, that if you live in New York City, or you live in New Jersey, or any place that has these wonderful farmers markets, look for sprouts. The one in Union Square, I get basil sprouts, watercress sprouts, broccoli sprouts, kale sprouts, rainbow sprouts, you name it. And I have them pretty much every meal, and the kids even eat them as snacks. So you
I
can
think that's great.
you can do so much with sprouts and get more bang for your buck, and you don't have to eat much. I can't imagine myself or anybody else eating 3 heads of broccoli during the day, but eating a cup or two of sprouts is easy. You throw it in your eggs, you can throw it in a smoothie, you can put it on top of your pizza, you can put it on anything you want, and it's delicious and goes right down.
Well, I think that's great, and I think people should, as they listen to programs like yours, and listen to people who are health conscious and know the importance of getting pure food, organic whenever possible, and so on. That this is a very good place to spend your time and attention in order to try to improve your health. I wanted to also just say on the vitamin D situation, one of the most important things I think people can do, and they can ask their doctors to do this for them, is to measure their vitamin D level. And it's the name of the test that you order is 25 hydroxy vitamin D, 25 hydroxy vitamin D, and that measures the serum level of the that's the best measure of your nutritional status of your vitamin D. And what you want to do is the labs are usually giving you a range of about 30 to 100. And that's by the way, that's in what in general is used in the United States. I had a situation recently where a relative from Israel, told me that her level was 40, and she thought, it was 100, and she thought that was pretty high, that she might be in trouble on that. But it turns out that in outside the United States, they use a different scale. I forget it's nanomoles or something, I think it is. But anyway, it's 2.5 times that of what we get here. So in other words, her 100 was actually equivalent to 40. And in general, I think that there's some studies now showing that even though the Institute for Medicine says, as long as you're above 30 or even 20, you're fine. I think there was a recent study by a couple of Harvard doctors that did a meta-analysis research on all of this, and they said there's pretty good evidence that if you go to at least 30 or 40 to 50, that's very reasonable. And actually with cancer, we even go higher than that. And the other thing is, of course, balancing your vitamin D with make sure it's balanced with vitamin K and some vitamin A. And a lot of doctors don't pay much attention to that. But that's certainly one of the things.
I think that's that's a big one. We've talked about it before, but it's good to mention again because it is so huge. People tell me all the time, but my vitamin D level is perfectly fine. It's right in range. I go, whose range?
Right.
The doctor's range or the functional healthy range? And then I work very hard with them to get them up to 75, 80s, depending on their stage of cancer and their particular lifestyle. I say, push it up. I like to keep mine north of 75. It drops down, then I have to take a little bit more D. But
Well, you have to be aware, though, that because a lot of people really don't know this, that when you start getting the D up around 180, 90, 100, and so on, if you're not paying attention to making sure that you got some vitamin K, and of course I have talked about the kind of vitamin K2 that I like is the MK4 rather than the MK7, which is found in most supplements, and the MK4 has got most of the human studies behind them, and like for osteoporosis done in Japan, they use 45 milligrams a day of that. And the important thing here is a good way to think about this is that vitamin D mobilizes or helps you to absorb calcium, which is very important for many different functions in the body, and the vitamin K2 helps the body to put the calcium where it belongs. So, for example, it activates a protein in the bone called osteocalcin that helps you to bring calcium into the bone. And it also activates another protein called matrix GLA, which is a protein that's found throughout the body, throughout various cells. And the function of that protein is just the opposite. It's to take calcium from soft tissues, joints, arteries, heart valves, take it and remove it from the tissues. So you want to get calcium out of the soft tissues. In other words, when we see, like with breast cancer, one of the most characteristics that are found on mammograms is an accumulation of calcium that could often indicate that there may be some cancer going on there. So in atherosclerosis, we see lots of calcium accumulating in the arteries and so on. So one of the things that helps to deal with that, to get rid of those calcium, is proper amounts of the vitamin K2, which is very depleted in the American diet. There's a pretty good article in
actually before you go on to that, I want to make one little point here that people confuse K1 with K2. So just because you say you're drinking a lot of drinking or eating a lot of greens, you're not getting K2, you're getting K1. So most people in this case cannot eat enough K2 rich foods that you would find in butter or hard cheeses, things like that, eggs, that you actually do need the supplement because it's almost impossible to eat enough, and you probably shouldn't be doing it anyway. So this is when a supplement can be extremely helpful.
Well, that's true, and part of the reason, of course, that we have so depleted in K2 is that in order to make K2, you need to have animals that have been grass-fed, and they make butter, milk that can convert to butter, which is from grass-fed animals, or various other tissues have the vitamin K2, MK4. The MK7 is found from fermented bacteria, like for example, some of the soy products, the natto. Natto forms the MK7. There's been a big controversy over whether MK4 or MK7 is better. The major reason that is given that MK7 is better is because it has a shorter half-life. A longer half-life, which says it remains in the bloodstream longer. So it says, so that must be better than the MK4. And I don't think that's necessarily true because you have to figure out why the half-life of MK4 is shorter. The assumption has been that the MK4 leaves the body. I think research will bear out that it's not that it leaves the body, it's that it goes into the tissues more easily. It's a smaller molecule than the MK7, so I think that the reason the MK4 has a shorter half-life in the bloodstream is because it's getting into tissues and doing its action better. But clinically speaking, I think I have seem to feel that the MK4 is better, although it's only present in very few of the products that are available on the market. Mostly it's MK7.
Right. And before we run out of time here, there's a lot of other substances that are known to target stem cells. We talked about curcumin, we talked about broccoli, black cumin seed. Those are all fantastic, and I highly recommend to be on everyone's list anyway. But there's also things like red and black raspberry powders or foods, although it's very hard to find fresh black raspberries. And if you're not picking your red ones, these things lose their potency very quickly. Apples, onions, red grapes. The list is very, very long. green tea, you name it. I do have it on my website. If you Google my name with cancer stem cells, you'll get the list of all the things. Everything up there is a natural substance with the exception of metformin, which is a diabetes drug that does show reason to think that it targets stem cells. You just have to be careful because it is a drug and therefore can have side effects. And it does. It doesn't have as many side effects as some other things, but if it doesn't work for you, that's one problem. In other words, your particular body, but also can have some side effects. So, but most of the things up there are very good for you in general and will help target those stem cells. So I encourage you to look at that list. And the very important thing to remember is you can't just take these things once a day. You want them throughout your day. So something with breakfast, something with lunch, or a snack and with dinner. It's not just like I wouldn't say just eat all your broccoli on Monday and you're good for the week. These things don't have a long life in your body. You want to eat them frequently. So have a nice variety and have them throughout your day, whether it's the supplement or the whole food. So.
I think that's excellent advice, and I'm glad to hear. I didn't realize that you had this list on your website. This would be very good for listeners to get into your website and look at those things. And you'll see that there are basically lots and lots of good things that you can get, organic foods and so on, and there are a few, as you say, few drugs. I'm a little more skeptical, I guess, of the drugs like metformin, although I know many of my colleagues use it, again, because it's a drug and there's been more research on it than a lot of these other things as far as research in people.
And it's really affordable. I mean, it's free if you have a health insurance because it's a $4 a month drug. So if your copayment is $5, it's free.
Well, I think that's great, and I'm sure there are many people that get some benefits from it, but just be aware that sometimes it can cause side effects in some people, and
more nowadays that we're finding out. Before, right. I think there was only a few. Now we're finding out daily there's a few more and unusual ones too that people mention to me, and they say, "Have you ever heard of that?" And I said, "No, but I'll add it to the list because there's a lot of things people never reported, or you can never exactly pinpoint what caused that effect. If you're taking 3 or 4 drugs, you don't know which one was responsible. But if someone is only taking one pharmaceutical and it's the only one they added, it could be suspect. So know that, yes, it's a very affordable thing to do, but it may not be right for everybody. So please do your research. So, Michael, we've got about 2-3 minutes. What would you like to...
Well, I would like to, since you brought this up, I think I would like to put a push in that people really need to be aware of the long-term dangerous effects of drugs, because I see it's so rare to somebody in their 40s, 50s, 60s who are not on 3 or 4 different drugs. And often they're causing all kinds of side effects, and neither the patient nor the doctor nor anybody else is aware that that's what's causing them. I'm giving a lecture next month to help with doctors to help patients get off medication safely, because this is an area that's not addressed either by conventional or, to a great extent, alternative practitioners. They'll put them on diets and put them on nutrients and so on, but they don't pay any attention to the fact that they're on 3 or 4 different medications. People are on like Klonopin or benzodiazepines for years at a time, causing long-term damage to the brain, cognitive effects, etc., and yet they don't pay any attention. And it's very hard to get off them because you have to do it slowly and you have to do it with nutritional support. So that's basically one of the kicks that I'm going to be trying to convey to the doctors that I'll be talking to next month.
Which is great and very important, because you're absolutely right. And as you get older, the list gets longer. I mean, they give you a pill for every single thing, and then there's a pill because you had a problem with the other pill. We all know the drill. It's just a terrible thing, and any time you can go to Mother Nature's medicine cabinet, it's the right way to do it. There are sometimes in extreme situations you might need, for a short amount of time, a pharmaceutical, but Mother Nature really was able to handle it and can handle it quite well. In fact, I will tell you very quickly the story. Michael knows this. I had a terrible stomach infection and right through my digestive tract, and my own doctor said, I could give you a drug, but Elyn, I know that you like to use natural substances instead, so I'm not even going to push my drugs on you. And I was like, bravo, doctor, very good. I wish you would tell more people that all doctors would tell their patients that. Why don't you try Mother Nature first? If it doesn't work, maybe we could talk about a pharmaceutical. So.
Not going to happen with the tremendous influence of the pharmaceutical company on the practice of medicine these days. But that's another story, not for another program.
For another program, right?
Yeah, we can talk about that.
Yes, we definitely will, because there's oh gosh, you and I could talk forever on a lot of different subjects. It's nothing's going to change soon, but we're going to do our best to change the world. At least I think so.
Well, did you get any questions, or you don't have time for anything at this point?
We probably don't. There wasn't anything in here that we weren't covering already. Sometimes questions come in that I know we're going to be talking about, and I try to fit them in, but I think we got it. And I will throw one little thing in there for anyone who is going to a conventional oncologist and who's going to pursue all of their options, including conventional therapies. One of the most important questions you can ask your oncologist is, what will your proposed treatment do to my cancer stem cells? And if the doctor looks at you like you're what? Then you need to find the door very quickly and find a new doctor. And because I'm a comic and I like to say things like that, but I do really mean it. If your doctor is not willing to protect your healthy cells while he's poisoning your unhealthy cells, he's not the right doctor. If he's never heard of stem cells or is not concerned about stem cells, he's not your
cancer stem cells.
Cancer stem cells, excuse me. Yeah. Cancer stem cells. Yes, we want stem cells. But if he is not really up on this or could not be bothered, then you probably need to either find a new doctor or do your own research and do that kind of work on your own. Because I do understand that in many parts of the United States there are not. And it looks like I am over my time. So, Michael, thank you very much.
Thank you, Elyn. As usual, great to talk to you, and hope to do it again with you soon.
We will do that. And everybody, if you missed any part of this show, you can find the replay on iHeartRadio. Also on my website, there will be a link to the iHeart. If you want those lists, just Google my name and next to cancer stem cells, or go to my website. You'll find that information. Thank you all for joining us today. Join us next week when my guest host, April Fontana, begins covering for me for the summer. You will love April, so stay tuned for some amazing shows. Again, this is your host, Elyn Jacobs, one-on-one cancer coaching. See you all next week.